When you look at different models of staying resilient or staying well or adapting in a positive way, often at the core of those approaches is the concept of self-awareness. And self-awareness is really about taking our own vitals when we're especially in a difficult situation. And the key is that the more you practice self-awareness, the more effective that it becomes. And doing a self-awareness or a check-in is really one of the ways to try to prevent that wear and tear that Carrie talked about. And the model that we'll be sharing with you is a model that was taken from the Canadian Armed Forces Resiliency Program. And what we found really useful is that it uses a non-stigmatizing language and in a system that really normalizes all of our reactions to life in general. And this is a reminder that using this is a way for us to maintain our own health and to build our resiliency skills.
So on the mental health continuum, there are arrows on both sides. And really, the point of this is that different people, healthcare providers, people in general, will move through different phases of health and wellness. And you can move back and forth. You can move between the colors. This can happen over the course of several months. It can happen over the course of a day or an hour, depending on what's happening. So there are labels at the top: healthy, reacting, injured, or ill. But when we talk to the people in the Canadian Armed Forces, really, they talk about using the colors as the label. So green would be this inner sense of zen. Maybe you had a really good night's sleep the night before, you're coming off a weekend, or you're coming off a vacation, and you actually feel rested. You feel like you're attending and concentrating well. Maybe you have a good sense of humor. You're enjoying what's happening. You're able to really stay in the moment, and you're able to be purposeful about your choices. And sometimes we stay that way for a little bit. Sometimes we don't stay that way for very long, depending on what reaches us. For those of us who have pagers, it might depend on how many pages you get. If by 7:30 you've already had 12 pages and people are expecting you in multiple places within the next 10 minutes and there's only one of you, that green can start to go down really quickly into a yellow. And different people are going to have different ways to compensate or balance for things. Physiologically, we don't like feeling unwell, and so we're going to find a strategy that's going to manage our level of arousal and how we're doing during the day. So there's a picture of me going to the fridge and getting a lot of food. I don't tend to go to the fridge and get a lot of food, but I certainly believe that chocolate balances the forces of the universe. So the more stuff coming my way, the more likely I'm going to be popping some chocolate into my mouth as I go about the day. It's a lovely little serotonin splurge. And so that's one way that I'm going to cope with things. It's a treat. I like the taste, and it feels like I'm doing something kind for myself as I move, but that's definitely an example of yellow. But the other tell that I have is that I get significantly less coordinated than I am already. So I'm going to walk into doors and chairs, I'm going to have bruises, I'm going to leave things that I needed, like my phone somewhere, and I'm going to have to track it back, and I'm going to drop things. And the picture is an example of dropping the food, which then goes into the loop of that was my treat and now I lost my food. And so we can get into these cycles of trying to take care of ourselves, but then we end up with the last straw, which is as we're trying to do something nice for ourselves, it doesn't quite work out. And normally we'd be able to roll with it, but we get less and less able to roll with it. So that's an example of being in the yellow where we're just not at our best and we're starting to show it. And then what can happen is that you've got this really nice buddy like I have with Carolyn. And so hopefully what we do is not only are we noticing what's happening with ourselves, but we've got our group or our team members checking in on us. And so she might say, "Are you okay?" And because she's my buddy and because of who she is, I'm going to be open and honest about how I'm feeling. And so I'm probably going to tell her that I'm starting to feel really stretched and I'm moving from the yellow much more into the orange. And so I'm using every skill I have to get through the day, and I'm just going to be trying my best. But to everyone else, to patients or people I supervise, I'm not going to go around talking about how much I'm struggling. I'm just going to tell them that I'm okay, and I'm going to keep what's challenging me on the inside, and to the outside, I'm going to try to be presenting like I've got everything under control. The problem with that is once you start to go, once you're stretched far enough, you're going to have leaks and you're going to have tells. And so it's about knowing what they are so that you can monitor it. And the tell that I usually have has to do with time, because I get stretched the most when the different things that I do in the organization, when everything starts to surge on me at the same time. and every hat starts to expand. And so people might say something like, "Do you have 5 minutes?" And my comment instead of yes might be, "Yes, but I only have 5 minutes." Or I might feel like when I see people who actually are appropriately taking their lunch, something like, "Must be nice to be able to take your lunch." And so the focus becomes that. And that's really one of the best signs and signals for me that, over the night or the next time I get a break, I have to implement some additional strategies in order to move as far as possible back to the yellow. When you get to the orange, to the later stages of orange and red, you really are in the ill zones. And so for people who have the genetic predisposition or the history of having a mental illness, this might be when you start to see those signs. Maybe depression or anxiety is becoming harder to control. There are some people who aren't going to be at risk for things like a mental illness, but they are going to be at risk for things like headaches, or maybe musculoskeletal, their pain's going to increase. Or they're going to have much more trouble sleeping, and it's going to be a consistent difficulty sleeping. But something in your body is going to tell you that you've moved too far, and this is really the time to be reaching out to the medical professionals.